Welcome to Easy Elite English Health and Wellness series. In Easy Elite English Health and Wellness, now you can see the skin. You can see an abnormal skin. Now, what is this? Why sometimes people develop this kind of skin problem? So, this skin condition is common to diabetics, although it is not confined to diabetics. Means people without diabetics also may have it. The most of the person having this skin condition are diabetics. So watch this video to know everything about this skin condition. Endocrine disorder. The main cause, endocrine disorder causes brown to black patches. You can see the patches, brown to black in various areas. So let's understand what it is. So Easy Elite English Health and Wellness series. Now the name of this disorder is Acanthosis Nigricans. Acanthosis nigricans is the name of this disorder. The brown to black skin patches you have may be itching or asymptomatic. Sometimes they itch, sometimes they do not. They are dark and brown to black patches. They are velvety areas. Obvious hyperpigmentation, excess of pigment deposition. Too much pigment has been deposited in certain areas, and the patient usually is diabetic but may not be diabetic. It is not necessary that every patient of Acanthosis nigricans has to be a diabetic patient, but mostly, usually, in diabetics it is more common. So Acanthosis nigricans, brown to black skin patches which may be itching, poorly defined velvety areas and obvious hyperpigmentation. Acanthosis nigricans. Let's understand about it and how to prevent it. Now common areas, neck, you can see the neck in both the cases at the back of the neck and on the sides of the neck. Armpit, you can see here, armpit. Groin, navel, it can be even on face or skin folds. So neck, as you can see in these two pictures, it can be on face, it can be on armpit, it can be on groin or navel. These are the areas commonly affected. Now we have got 5 causes. Cause 1, familial, that is genetic. Cause 2, endocrine. Cause 3, obesity. Cause 4, drug related to intake of certain drugs or administration of certain drugs, and malignancy or certain types of cancer. So let's dig deeper into Acanthosis nigricans. First cause, familial or genetic. Now familial or genetic acanthosis may arise as a result of autosomal dominant trait. Autosomal, that means of the 23 pairs of chromosomes we have, the 22 pairs are autosomes and the other 2, that is the other pair X and Y, these are called sex chromosomes. So autosomes are same in all, but the sex chromosomes will differ in male and female. So since it is autosomal dominant, not X or Y sex chromosome, it's equally likely to occur in both the genders. If it is on X chromosome, then sometimes it happens that one gender is affected more. But since it is autosomal, that is not on the sex chromosomes, it's equally likely to occur in both males and females. Because it's a dominant trait, any one parent having it will mean at least 50% chance, and both the parents having it would increase the risk of the child to at least 75% or even 100%. Cause 2, endocrine or hormonal dysfunction. Insulin resistance is the main cause. Insulin resistance, type 2 diabetes. Type 2 diabetes, insulin resistance is the primary or predominant cause. Excess androgen hormone, Cushing's disease, acromegaly due to excess growth hormone, Addison's disease, hypothyroidism, due to which thyroid stimulating hormone will be in excess in the blood. So excess androgen and obesity may be a concurrent association because most of the persons suffering from acanthosis are obese. Mostly they're obese. Cause 3. Obesity. Insulin resistance is more likely to occur in obese and dark-skinned persons, sometimes referred to as pseudo-acanthosis nigricans. So, pseudo-acanthosis nigricans in obese persons, fat persons, overweight persons. So, both diabetes and obesity are high-risk factors. In addition to hormone imbalance, insulin resistance, obesity and diabetes are very high risk factors for Acanthosis nigricans. Drug related. Now, what are the drugs? Nicotinic acid. You can see here nicotinic acid, glucocorticoids. These are actually steroids, glucocorticoids, combined oral contraceptive pills, birth control pills, and growth hormone therapy, OC pills, steroids, glucocorticoids, and nicotinic acids. The use of these drugs could be one of the reasons for the disorder Acanthosis nigricans in some patients. Malignancy. This may indicate cancer of the GI tract, prostate cancer, you can see here, prostate cancer, breast cancer, ovarian cancer, lung, stomach, or lymph node cancer sometimes. So it is, it could be associated with cancer of the GI tract, cancer of the prostate, cancer of the breast, or cancer of the ovary. So cancers could also be associated with Acanthosis nigricans. So how do you treat it? First of all, check for cancer and diabetes. Check for cancer and diabetes, and if you find cancer or diabetes, then initiate appropriate treatment. Check for thyroid problems, and if you find thyroid problems, then initiate appropriate measures. Control blood glucose level by proper diet. Weight loss measures. In case of obesity, weight loss measures using diet and exercise. Use fade cream like selenium sulphide to lighten skin color. And stop the drug if it is due to nicotinic acid or OC pills or glucocorticoids. So check for cancer and diabetes and thyroid problems and treat them. Control blood glucose level by diet control. In case of obesity, initiate weight loss measures, that is diet control and exercise. Use topically fade cream like selenium sulphide to lighten skin color, and stop nicotinic acid or OC pills or glucocorticoids if that's found to be the cause. Diagnosis, treatment, use, and discontinuation of drugs must be under supervision and direction of a qualified health expert of a clinic or hospital. The video is for awareness and not for self-medication. We are giving this video for public awareness, but this is not meant to substitute the going to a hospital or consulting a doctor. In spite of all this awareness, you will always take the advice of your doctor and visit a clinic or a hospital for necessary treatment. So that's all. Easy Elite English Health and Wellness Education for Public Awareness. Remember, health is the best wealth. So, wishing you good health. Thank you and goodbye.